The Affordable Care Act, ACA, also known as Obamacare, was signed into law in 2010 with the aim of providing affordable healthcare coverage to millions of Americans who were previously uninsured. The ACA brought about significant changes to the healthcare industry, including the implementation of new regulations, the establishment of state and federal marketplaces for buying insurance, and the expansion of Medicaid. One of the most significant impacts of the ACA was the reduction in the number of uninsured Americans. Prior to the implementation of the ACA, approximately 50 million people in the United States lacked health insurance coverage. Since the law's passage, the uninsured rate has fallen to a historic low, with over 20 million people gaining coverage. The ACA also introduced new protections for consumers, such as the requirement that insurers cover people with pre-existing conditions and the provision of free preventative care services. Additionally, the law implemented several cost-saving measures, such as the creation of accountable care organizations and the implementation of payment reforms aimed at reducing healthcare costs. Despite its successes, the ACA has been a source of controversy since its inception. Opponents of the law have argued that it represents government overreach and infringes on individual freedom. Some have also criticized the law for increasing healthcare costs and reducing the quality of care. One of the most controversial aspects of the ACA is the individual mandate, which requires most Americans to have health insurance or face a penalty. The mandate was seen by many as a necessary component of the law, as it encouraged healthy individuals to purchase insurance, thereby balancing out the costs of covering sicker individuals. However, opponents of the mandate argued that it was unconstitutional and represented an infringement on individual rights. In 2017, the individual mandate was effectively repealed as part of the Tax Cuts and Jobs Act. Another point of contention has been the implementation of state and federal marketplaces for purchasing insurance. While these marketplaces have helped to increase access to coverage for many Americans, some states have chosen not to participate in the program, leading to disparities in coverage and access to care. Overall, the ACA has had a significant impact on the healthcare industry and on the lives of millions of Americans. While the law has been the subject of much controversy, its successes cannot be denied. As the debate over healthcare reform continues, it is important to consider the lessons learned from the implementation of the ACA and to work towards a system that provides affordable, high-quality care to all Americans.